Hi, I'm Dr. Christopher Trahan. I'm the founder and the medical director of the Olympus Center for Holistic and Integrative Medicine. We practice here what's called natural healing and alternative medicine, complementary medicine, what's sometimes known as functional medicine. We do things like acupuncture, herbal medicine, nutrition. We also provide, when appropriate, high-tech lab tests that even most medical doctors are not utilizing. So most of my practice is about doing acupuncture and herbal medicine on a day-to-day basis. And I have here my herbal pharmacy. It's a very unique, comprehensive pharmacy. I am trained in both Chinese and Western herbal medicine, and I have over 300 herbs here comprised with individual herbs and formulas, which is certainly among the most comprehensive, if not the most comprehensive herbal pharmacy, combining Western and Chinese herbs of any private practice that I know of in New York City. I also work with something called homeopathy, which is a tradition over 200 years old, which is also a very profound healing system. And my practice ranges from treating pain syndromes, including muscular problems, neck and back pain and whatnot, sports injuries, to any other kind of pain syndrome. Acupuncture is known for treating pain. It doesn't just block pain, it can fix the cause of the pain oftentimes. And then on the other hand, acupuncture does not merely treat pain, it also gives the body what I would characterize as like a metabolic and neurological tune-up, and so it can actually enhance the health and treat just about any ailment. So I treat digestive problems, respiratory problems, allergies, again any pain syndrome like a headache or digestive pain. I treat women's health issues, menstrual issues, fertility issues. I also treat children, all of this with great effect. When we do Chinese herbal medicine, one of the strengths is that we use very comprehensive herbal formulas. So this is a sample of a Chinese herbal medicine formula. This would have formula could have anywhere from 4 to 6 to 8, 12, sometimes even 16 herbs in it. And the daily dosage could range anywhere from 1 ounce to 4 ounces. The strength of Chinese herbal medicine is not that the plants are superior to the plants that grow in America, but the science of Chinese medicine, herbal medicine, has been established for literally thousands of years. The first scholarly medical textbook of herbal medicine was written over 2,000 years ago. And in that book, there are formulas, not just indications of individual herbs, but formulas, or like recipes. And so we have a blueprint. And in Western herbal medicine, we don't really have that. We have lots of knowledge, including modern scientific knowledge of the individual herbs, but we don't have the same encyclopedic track record of formulas. So you just got, again, more of a blueprint to deal with the Chinese herbs. That being said, and also we do also have modern scientific information about the Chinese herbs. That being said, I also use American herbs quite a bit, and I use my knowledge of Chinese medicine and how formulas are constructed to formulate formulas that are either all American herbs or may combine American and Chinese herbs. And one way I do that is working with tinctures. These are liquid extracts. So when you have an herb, you can make a tea, which means you simmer it or boil it in hot water. You can grind it up and make it into a pill. Or you can make it into a tincture, a liquid extract. And this is by soaking the herbs in some percentage of distilled water and grain alcohol. And this is how herbal medicine was practiced and how the medicines were extracted to a great degree in America when herbal medicine in the turn of into the 20th century was a predominant form of medicine. Also, while at what we call allopathic or modern medicine kind of pushed herbal medicine down in the early 20th century, and we had antibiotics come in and everyone thought that, okay, this is all we need, and they kind of turned away from herbal medicine. Herbal medicine has existed in a continuous, strong role in herbal medicine around the world, and is probably, historically, the most profound and efficient and economically efficient system of medicine in the world. And so it has persisted, obviously, in China, but also South America, India, and whatnot. And in America, it's enjoying a renaissance over the last 20 years. Last year, for instance, even with the economy in a recession, the herbal industry, including retail sales over the counter at health food stores, and also in the context of herbs in a professional practice like this, the herbal industry grew 3%. And so Americans are coming back to it. Just to give an idea of the kinds of things we do here. Also, this is a learning center. It's a medical practice and a healing center, but I do a lot of educating with my patients, working with them with diet and nutrition and lifestyle, and I attend seminars and expand my knowledge, and I subscribe to journals. This is what's called the Townsend newsletter. This is a Western medicine-based natural healing journal based on herbal medicine and nutrition mainly. This issue has articles about treating anxiety, depression, insomnia, and cancer, talking about plant-based diets. This is another issue in the Townsend. This is focusing on liver disease. The liver, of course, is the major detoxifying organ in the body. And this talks about things like milk thistle, which is like the Western herb for the liver. And also there's a nutritional substance called alpha-lipoic acid. I also subscribe to a journal called Herbalgram, put out by the American Botanical Council. And this is kind of like a medical anthropology, or also what we call ethnobotany. This is a great article in this issue about tea's Silk Road journey to Tibet, about the history of tea and how it had spread through Asia.